You are viewing Golden Vital Voices, and my name is Barbara Perret. Today we have an exclusive invitation by Dr. Jeffrey Goldblatt at Shoreline Medical Spa in Deep River, Connecticut. Dr. Goldblatt has invited us into his office where we can discuss some of today's health and wellness topics. Today we are here with Dr. Jeffrey Goldblatt at Shoreline Medical Spa in Deep River. Dr. Goldblatt, I know that you are a retired vascular and general surgeon.
Correct. I started my career actually as a surgeon, and I retired about 10 years ago. And at this time, I've worked on different things to keep me occupied, like the medical spa that I have now has to do with all cosmetics, but some other things that aren't really cosmetic but are good for your health.
Absolutely. And what did you witness in your career that you thought would be most helpful for us to know today?
That's an interesting question. Briefly, when you do surgery, you have about a 99% of people getting better. When you practice medicine, nobody gets better unless they have an infection, and they just keep taking medication. And that then moves into what I do now, which is my attitude is to keep you healthy by doing healthy things. The pharmaceutical industry's attitude is to make lots of medicines for some illness that you've created because you've done things wrong. Longevity is a very simple thing. It involves eating healthy, having very good friends. It also involves things to do with different occupations as you retire from your normal occupation, and exercise. It's very, very simple how to live a long, healthy life, but it doesn't involve going to the pub and drinking every afternoon. It doesn't involve overeating so many of the foods that have been genetically modified, and also the preservatives in these foods. You really need to look carefully on the label to what you eat, how you eat, and these are the things for longevity.
I know that you had shared with me how easy it is to get an application on your phone. So when you're shopping for healthier foods, you just scan the item and it'll give you some idea of
what is in the food. Yes. This is one, I believe there's probably more than one application around, but I actually recommend to the patient something called Yucca. It's spelled Y-U-K-A, and there's a carrot on the app. And what you do is you scan the barcode, and you will be so surprised at how bad some of these foods are that you eat.
Even the ones that are in the health food aisle.
Exactly. Yeah. And the cereals that you think are so wonderful, scan them at your local grocery store with that app, and you'll be surprised.
That's true. And I've done that, and I've used the app based on your recommendation, and I was surprised. What would you advise someone to do to keep their immune system strong?
Well, basically, keeping your immune system strong involves reducing your stress, and that's something that you have to work with. There are many supplements that are very good for your immune system. Contrary to what you may see in the big pharmaceutical literature, most of these things have worked well for probably 6,000 years. Chinese medicine goes back.
We can edit.
It goes back that long. But it's amazing how well the natural medicines work. And the only problem is when you go online and you see these things on the different sites where they have social interactions, and people unfortunately lie. And that's one of the big problems, to differentiate what's true and what's not. But certain things are pretty obvious after a while, and they're perfectly healthy. You have to exercise, and you don't have to exercise like you see in some advertisements. You just have to go do something, whether you go to the gym or whether you go to your cellar or basement and do something, but you do upper body and lower body exercises. That's one. Number two, the other important thing is being involved with people that you're happy with, because you don't want to be stressed. The other thing, of course, is again, the supplements and the foods. There's a television program called The Blue Zones, and it's either on Netflix or Amazon. But anyhow, it's the 7 cities in the entire world where people live to be 90 and 100. And you see what they do. The interesting thing is they all do something a little differently. But if you look at it carefully, you realize that really they're all doing the same thing. They're all exercising one form or another. They all have good friends, and they all eat correctly.
I know that you have mentioned don't eat sugar.
the interesting part about sugar is that so many of these overloaded sugar items are in everybody's grocery store, and the kiddies like them and they get drawn to them. These are not healthy. Okinawa was one of these blue zones. 20 years ago, they did the interview on everybody, and there was no fast food and there was no sugar garbage being sold. Unfortunately, 20 years later, they no longer live as long as they used to, which is sad. The other very important fact, of course, is obesity. I'm sure that anybody 50 or older remembers being a skinny person when they were kids, and very few overweight people. But we have allowed our foods to contain these preservatives and additives that are outlawed in Europe. It's really sad, because when you go to Europe and sit down and have a big meal, pasta, everything in the world, you don't even gain weight. You don't feel lousy. You feel fine. Not in the United States. So unfortunately, I tell all my patients, if you're going to buy pasta, make sure it's produced in Italy, not the United States. We have an 80% obesity rate. We have horrendous gluten allergies. We have autism. The list goes on. When I went to medical school, which was 1963, my pathology book, it stated clearly that lung cancer comes from smoking cigarettes. And what are we doing? Still smoking cigarettes.
And then they put them into different forms to
Yeah,
attract us to keep smoking them.
right. Yep.
Well, that's some really good advice. And I know that as a consumer, to shop can be challenging when you're looking for healthy things to eat. Some are once again planting in their gardens, and they're keeping away
Yeah.
the toxic fertilizers, and they're raising chickens and trying to do it in a healthy way.
Yeah.
And they can even be challenged about what to feed the chickens,
Right.
right?
It's like eating fish. You don't want any farm-raised fish, because the garbage they feed the fish, it's contained within the body of the fish, the meat. You want wild, and it's just so strange how we allowed ourselves to fall in this situation. We took our eye off the ball. And then corporations like to make a lot of money, so they do things that are easy for them. And that's why they have the preservatives, all these things that make it taste good, but they're not healthy for you. I do notice that there's a lot of aisles in the grocery store you don't even need to go down. Right.
So the good news, and that's really good information, and it's valuable, because the information that we get isn't really meant to scare us. It's to then seek out
Alternatives. Right?
alternatives.
Yeah.
And the more we seek those out and then spend our money in that direction, the more it will become available.
I've been around a very long time, and when I went to medical school, I didn't know anybody. I hadn't even heard of autism, and all of a sudden the rate of autism just keeps climbing and climbing. There's certain things that we do that don't make any logical sense to me as a physician, and I won't go into those.
Okay, we'll save that for another time.
Yeah.
But I do hear some good news in that, as long as you're strength training, and you don't have to be a bodybuilder, but use your muscles. Even if you have certain ailments, really try to move around, and then rest.
Yes, rest
Get your
is good.
sleep, because then those two things in combination will help to keep your immune a little stronger.
Yeah. Well, basically, when you go to sleep, you destroy all these bad things that you manage to breathe in, swallow, eat, and it's important. We have many things that are called peptides, and peptides are amino acid sequences, like your genetic sequences, but they're in a smaller form, and they tell your cells what to do. It's just wonderful. These things are just, the unfortunate thing is that we haven't allowed some of the literature that was evaluated and created in Europe and other countries to enter the American market. The only thing we ever see is what the Food and Drug Administration decides that is a good thing to show people. Things are changing, and people are catching on that if you have an 80% obesity rate, you're in trouble.
So what I hear from you is look globally for answers.
That's correct, yeah.
And the blue zone, I know that there's a book that focuses on these zones.
Yeah. Well, this was a TV presentation.
Okay.
I'm not sure if they have it in book form, but basically it's very simple. I mean, the exercise you do, especially with your upper body, is important, because as you age, you lose muscle mass. And when you lose muscle mass, you don't walk well, you don't do lots of things well. So that old statement, use it or lose it, is correct. You have to do those things.
Well, that's valuable information. And I know that you have a busy schedule today. I appreciate you taking the time and
Sure.
inviting us into
That's okay.
your office. We'll do this again
Sure.
and talk
Sure.
about other topics that help
And
people.
that's fine. Yeah.
Well, thank you, Dr. Goldblatt.
You're welcome, Barbara.
So there you have it. Eat right, exercise, spend time with people that you enjoy. When it comes to eating right, stay away from the sugars and terrible additives that have been put in our food. Thank you to Dr. Goldblatt for sharing this information, and we hope to see you soon. Thank you for joining us here at Golden Vital Voices.